Hey guys, welcome back to my YouTube channel. How are you guys? What's going on? By the title of this video, you already know what we're coming here to talk about, and this video is just going to be brief. I'm not going to talk too much. I'm here with my friend Perpetua. She's a biomedical scientist, and we're here to talk about coronavirus. Rather, she's here to talk about coronavirus. So I'm just doing the question asking because I've been so paranoid for so long. And about last week, I approached her and told her that I really want to know more about this virus because I read a lot of things online. I don't know if I'm freaking out in vain or over panicking. I don't know. But after this video or in between this video, we'll be able to tell what's going on because I can't even talk too much. So let's just start because everywhere is just crazy right now. Too many sad news everywhere. Like it's so sad, it's heartbreaking. What is happening in the world right now is so heartbreaking. Like I can't even. But anyways, let's start. So Perpetua, you can introduce yourself. No, just just.
Okay, so I'm Pep and I'm a biomedical scientist. So we're here to talk about coronavirus infection. Yeah.
Okay, so now what is coronavirus?
So coronaviruses are a large family of viruses that cause mild infections like common cold to severe ones, like the severe acute respiratory syndrome. And then the coronaviruses are zoonotic in nature. What it means is that they are transmitted between animals and then humans. So there are so many strains or types of coronaviruses in animals that cannot be found in humans. So there are so many strains or types of coronaviruses in animals that cannot be found in humans. But the novel coronavirus is actually a new strain of the virus that had not been previously detected in humans.
Wow.
Yeah.
Wow. Novel.
Yes.
I'm just saying about that. Wow. So like what are some popular symptoms of the virus?
And the basic symptoms of the coronavirus infection, we have runny nose, fever, cough. And then there are more severe ones like severe acute respiratory syndrome, pneumonia, kidney failure, and even death.
Wow.
Yes.
Wow. My God. Wow. But like the cases that they've recorded recently, I saw something like 11,000 being infected and like they cured 5,000. Is that a lie or is that just the internet being smart?
No, that's not a lie. You know, actually there are claims that elderly people who get the infection are likely to pass away. But then when you are not elderly and then you don't have any underlying health condition, you have a strong immune system, you are likely to recover from the infection. Yes, so that will be a lie.
That would be like wow. So what's the intensity of the coronavirus? How severe is it?
The coronavirus, as it stands now, is very severe. Let's take some statistics. So it began in Wuhan, China, in December 2019, and then it has spread fast and far to other countries, both in and outside of Asia. And at the end of January 2019, WHO declared the situation as a public health emergency. And there has been over 100,000 infections caused by coronavirus across the globe, with more than 3,800 deaths recorded according to WHO statistics. And now it's been declared a pandemic. Yes, so it's actually very severe. Yes.
Wow, it's more severe than I ever thought. Wow.
Yeah.
My God. So like how does it spread? Like, how quick is it to spread? Like
yes, I earlier established that it's a zoonotic infection, and usually it's transmitted from animals to humans. and bats are the common carriers.
Bats, okay.
Yes, for the coronavirus. But bats don't directly transmit to humans. So transmission usually is through an intermediary animal.
Okay.
Usually a domestic
Animal.
one.
Okay.
So in Wuhan, for instance, the infection was linked to a live animal market,
Okay.
which was eventually closed down.
Okay.
But then it began spreading from person to person. It became more like a community spread.
Yeah.
And some didn't even know how they got the infection. Yes.
Wow. 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 My God. Wow. So given the fact now that sorry to say Nigeria has reported a case or two,
Yes.
how much at risk do you think Ghana, like how much at risk do you think we are?
Ghana is not safe.
Okay.
Okay. Because just yesterday Cote d'Ivoire had a case of coronavirus. Burkina Faso has had a case. Togo has had a case. So we are surrounded. And looking at Africa in general, Nigeria has had a case. Senegal, Algeria, Tunisia, Egypt, South Africa, DR Congo. So it's creeping in on us. So it's very critical that we step up our readiness as a country, and then in particular put in place effective screening mechanisms at the airports and other major points of entry into the country to make sure we detect any case very quickly so that we can contain it before it spreads.
My God. Wow. So what are some preventive measures that we can take
To prevent the infection? Frequent hand washing, very important. So you go out and come in, wash your hands. Even when you are out, sanitize your hands on a regular basis. So you can use an alcohol-based rag to sanitize your hands, and then you must keep a distance from someone who is coughing or sneezing. And then when you are coughing or sneezing, so you should stay out of work. Wait till you recover, then you can go back. And then you shouldn't touch your eyes, your nose, your mouth with your unwashed hands. And for people traveling, I think maybe we can limit traveling for now, especially to countries that have been affected. Yes.
Wow. So like, using hand sanitizers, is that going to really prevent you, or it's just going to like 50-50?
It's not going to totally prevent you, because someone can cough or sneeze into the atmosphere and then release some droplets. We call them aerosols. You can breathe that in and then get infected. So it's good to sanitize your hands often, but you can as well catch it through the atmosphere. So it's not like a sure way.
So like a lot of people now are wearing surgical masks and gloves. As you said something about inhaling to the atmosphere, do you think that's why they should wear it, or would that still?
Surgical masks prevents pathogens and then pollution. But it doesn't really help in the context of the virus.
Wow.
Okay, because they are not designed to keep out viral particles. So yes, to some extent it may help, but the effects will be very modest. Yes. So someone can wear the surgical mask when they are coughing because they don't want to spread the infection. But when you are coughing or sneezing, stay away from public areas. Wait till you are fine, then you can go back. And then those who are taking care of healthcare providers should wear face masks. People who have the coronavirus infection should also wear to minimize the risk of spreading the disease.
So as a biomedical scientist now, do you think that this virus will be called, like, I don't want us to bring in like religion. Of course, we're going to set up based on religion. We say spirituality. We would say, okay, God is this. But as a biomedical scientist, do you think that we're anywhere close to finding a solution or an antivirus medication or something, then do you think it's possible?
Well, we don't want to spiritualize this. I think we need to fight this as a global something. I know that a vaccine is being prepared. This is a pandemic and it's spreading fast. And I know that they are putting in place measures to curb this menace. So I don't see it going far. I'm being optimistic.
Think about it.
Yes, I don't see it going far. I know this whole thing will come to an end.
But still, we don't have to be ignorant about the virus.
But we still have to be on our guard.
Of course, because it's real, it's happening.
It's spreading.
It's spreading so fast.
And it could be fatal.
It could be. Because I mean, if you have it, if you go outside now and catch it, you can bring it to your family or maybe five, and everybody
they'll think, oh, it's common cold. Before you realize it's something else.
We just have to stay in our houses, and I don't know, because I know football games, basketball games,
it's affecting everything. I think Ghana government. I saw some people being trained at Kolebu, and then Confanoche, and then in the north to help combat the virus should it show up. So I'm sure there are some measures
that they're taking. Hopefully,
that maybe just because it hasn't.
Because I see people, I saw I don't want to talk about it, celebrities still trying to post a concert. Like people, like the foreign celebrities are cancelling, but Africa here, they are still promoting it. So what I'm just trying to say is that because Africans, we are known for ignorance, most of us. So it's like,
or maybe it's just negligence, because now we are really not ignorant about this.
Well,
it's all over. Everyone has heard about coronavirus. Even if you don't know, you know it's deadly. Yes, so maybe it's just negligence, but we shouldn't ignore such a serious.
Wow. Okay. Hopefully, it gets better. 2020. So far has been bad in that sense, but people are dying now.
In the sense of the coronavirus,
it has been bad because there's nothing. Even though you don't know the person, someone dying, when you just hear that someone,
it's alarming. And you don't know when it will get to you.
Exactly. God forbid.
So, yes.
Okay. Well, Perpetua, thank you so much for your time.
You're welcome.
Thank you for educating us, educating me as well, because there are some things I didn't even know, and I know them now. And I will not be over paranoid and wear my gloves anyhow. I'll try to sanitize as possible. So like, is there a particular way you wear the mask? Because I was hearing some people saying you don't wear you wear the green part when you're affected and the white part when you're not affected.
I haven't seen that. I don't know that. But you don't even wear the mask and walk around. And you
except
wear
you're
the
traveling
gloves,
or
you kind
something.
of put some fear in people, don't you think so?
Yeah, but
or maybe they'll think you have it and you're trying to prevent spreading it. So let's just be free but still be on our guard. So if you're not coughing, don't wear the mask. You don't wear the gloves. Just sanitize as often as you can, and then wash when you get a chance to, and you'll be fine.
Thank you so much.
You're welcome.
Guys, thank you so much for doing this.